WEBCAST is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. Today is Friday, June 12th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Friday series of DDA updates, and thank you for joining us. We have several presenters for today. Bernie Simons, the Deputy Secretary for DDA, Carol Beatty, Secretary for the Maryland Department of Disabilities. We also have Lori Markland, Executive Director of the Assistive Technology Program, and Christie Stewart, Section Chief for the Secondary Education of the Maryland State Department of Education. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There is one option to listen to the webinar today, and that's by computer. There is a handout for this webinar, and you can find it in the handout section in the panel to your right, and they can also be emailed. We will be recording the webinar and posting it on the DDA website, and any questions you have can be submitted through the question box on your right, and if it says chat, you can also submit them through the chat box. So now I'd like to introduce Bernie Simons. Good afternoon.
Good afternoon, and again, I want to thank everybody for attending this webinar today. We are, I think this is our 12th webcast that we have been working on every Friday. And again, I want to thank everybody for attending. We will do our regional office updates, and we are privileged as the introduction was done to have Secretary Beatty, to have Christie Stewart from our Department of Education, and Lori Markland with the Assistive Technology Program. So again, I think that this is a really good opportunity. Last week, you may recall, we had some providers talk about what they were doing for reopening. We know that we've had a lot of individuals who have not been going to day program, being at home, and that many providers and individuals have already had some items that they can utilize to receive their supports identified in their person-centered plans remotely. So we thought it was very important for us to have that discussion, and where we are with transition, especially in the TYs that we know that we have, and we have an actual increased number this year than we had last year. So you heard the governor this week announce about stage 2 and moving forward, and the gradually reopening when he was doing his press conference on Wednesday. We at DDA have the highest priority for health and safety and well-being for all of our participants in our waivers, for our families, for our staff, for our providers. And again, I want to thank those who have expressed interest in working with the regional directors, because each region within the state has different challenges, and some of the numbers are a little lower with the number of people who have tested positive. And so we will not be doing any type of statewide reopening. We will basically do by regions, and we have asked the regional directors to work with the regions, work with the staff in the regional offices, and work with the providers to develop some guidelines. These are not mandatory guidelines, but they are guidelines so that when providers have discussions with individuals and families, we have the opportunity to open and reopen safely. And so putting that all in. I also want to point out that on June 9th, the United States Department of Health and Human Services issued a provider relief payment that is available. It was about $15 billion, I believe, and it was for providers to apply directly. I don't believe it. Any of the money comes through the state. It goes directly to the providers, and it's for Medicaid providers and CHIP providers. And so, again, I think people, and we'll put that link on our website, But again, I think people knowing where they are and seeing some emails and knowing where we are with budget for this year, that obviously we did our projections yesterday, started to take a look at our budget, and there has been an increased cost to DDA, obviously, with the attendance and the people who've been in isolation, et cetera. I will say that we have had PPE going out on 3 different occasions to the regional offices and to the providers, and we are working with the regional directors again. Actually, we started this morning starting to take a look at, so what do we need for additional PPE to meet the needs of people who are provider agencies, people who are self-directing their services, and people who are in microboards. And so as we continue in this 12th webinar, I want to be able to give you an update, as we have in the past webinars, about the number of people who have been confirmed positive, negative, passed away. And these numbers are as of yesterday, the 11th. And so in the South region, we have had 202 confirmed cases of participants, 58 negative, 1 pending, and unfortunately we have had 14 individuals pass away. In the East, we've had 29 confirmed, 28 negative, no pending, so we're up to date, and we've had no deaths. Central has had 131 confirmed positives. 173 have tested negative, 9 are pending, and we've had 11 people pass away in the Central region. And in the West region, we have had 18 positive, and we have had 38 negative. We're up to date. There are 0 pending results that we're aware of, and we have had 2 people pass away. I think it's important to go back and take a look at our staff, as we started doing a few weeks ago. And in the South region, we have had 133 staff test positive, and we have 4 staff pass away. In the West region, we've got 25 staff who tested positive. In the East, we've had 49 staff test positive. And in the Central region, 132 people who have staff who have tested positive. As we go to the next slide and we look at where are we with our tracking and our participants, you can see that on the left-hand pie chart that illustrates the 17,764 people that we support through our 3 waivers, and that of which 2% of that have tested positive, and that held, I believe it was 2% last week also when we looked at this chart. And then you'll see the chart on the right shows the number of participants by region, and as you can see, there's been an increase in that number, not a lot, but some. You can see it's gone from like 191 to 196, etc. So again, I just wanted to be able to share this information with you so that you can see that we are tracking all of this. I want to commend the providers, people who are self-directing microboards, for staying in close contact with our regional offices. We do a call Monday through Tuesdays and Thursdays now with the regional directors to get updates, and we will continue to do that so we can share the current information that we have from all the people who are participating. You can see then this chart illustrates from May 22nd to June 5th that there was an increase of 8 participants who passed away, and for a total of 363 people who have tested positive. So we actually have gone up by 8 since we started. from 20 to 28 on the participants. And again, 363 people who have tested positive. And the pie chart on the right shows that those 28 participants and who have passed away, which represent 7% of the 363 people who have tested positive. And so again, we've been showing these pie charts and this tracking for the past few weeks, and we will continue to do so. So we do have a commitment. We'll continue to assess and adjust the processes and seek options for people that we support, families, providers, etc. We'll continue with collaboration with everybody. And then again, I want to thank everyone who, since we're all in this together, who have been diligent in working forward with this as we plan on what does reopening look like. And again, I want to thank the three panelists who are with us. And now I want to introduce Secretary Beatty. Thank you.
Good afternoon, everyone. I want to thank Deputy Secretary Simons for inviting me to join his weekly webinar this week to talk a little bit about the Department of Disabilities and also to share with you a little bit about our partnership with DDA. So you can see the mission and the vision of the department. I just want to tell you that we are the only cabinet level Department of Disabilities in the country. We do both direct support services, and I'll talk a little bit about those, but we also primarily work on cross-disability policy issues with all of our state agency partners. There is not one state agency that does not, of course, have some responsibility and some regular dealings with people with disabilities and their families. And so we work alongside our state agency partners to develop good, solid public policy for people with disabilities. So some of the services that we provide, we administer the Federal Assisted Technology Grant, and we also will begin in July to administer the Telecommunications Access Program for Maryland. We have an attendant care program. It's very small, the only self-directed personal assistance program in Maryland for people with disabilities. We also administer Access Maryland, which is a capital fund that makes awards to state-controlled properties for accessibility purposes. We, as I'm sure you're all aware or would guess, we do a lot of partnering with the Department of Health, including the Developmental Disabilities Administration, and we work with them in areas such as employment and transitioning youth, housing, self-direction. During the COVID response, I feel like our joint efforts have intensified, and some examples of our working together in this area. The Department of Health and the Department of Disabilities issued guidance to hospitals allowing for supports of individuals with disabilities. We were helpful, I think, in the governor's announcement that direct support professionals working in the community are essential healthcare workers. We have helped to create a FAQ about face masks and how that impacts people with disabilities. And we were, I hope, helpful in the development of a grocery letter, which is a letter that group home administrators can use to when their staff are purchasing necessary items at grocery stores, that they can go above the maximum amounts that are allowed to regular shoppers. So those are just a few of the areas that we have worked together, and we're going to continue to work together through the recovery. And I want to let you know that we do have a director of constituency services. Her name is Nan Brittingham, and her number is 410-767-3948. And I'll repeat that. It's 410-767-3948. And Nan takes calls constantly and tries to address constituency issues as it relates to people with disabilities and their families. And then I'm going to introduce Lori Markland. Lori works for the Department of Disabilities. I know she's not going next, so but I'll introduce her, and so she's ready to go after Christie. So Lori is the Executive Director of the Maryland Assisted Technology Program. She's worked in the AT field for 20 years. She holds a bachelor's and a master's degree from the University of Baltimore, and she's a longtime resident of Baltimore City. Thanks, and if you have any questions, just let me know.
Thank you, Secretary Beatty, for joining us, and we really appreciate your partnership. Before I move on to the next slide, I just wanted to let everybody know also that we have on the line who joined us for our session today, especially on the Q&A, is Marlena Hutchinson, who is the Acting Director of Long-Term Services and Support, who oversees the management of all of our 3 waivers for the DDA. So she's also joining us as well today. So I'm going to move over to the next presenter.
Good afternoon, everybody. My name is Christie Stewart. I am the Section Chief for Secondary Transition under Marcella Frankowski, who is the Assistant State Superintendent of the Division of Early Intervention and Special Education Services at the MSDE. Marcella was scheduled to be here today. She does send her regrets, but nevertheless, I am excited to be here today to talk about transitioning youth, because it really is what I talk about a lot. It's what my area is. So just to begin, we know that this is, can you go to the previous slide? I'm sorry, Patricia. We know that this is a crucial time as students are preparing to exit the school system and moving on to the adult service system, and that's been a real priority. So the federal guidance, so folks really understand from IDEA, which is our entitlement legislation that serves students with disabilities, it hasn't changed in response to COVID, nor have the expectations, the timelines, or the requirements. We did not receive waivers. IDEA remains our blueprint for providing free appropriate public education, or FAPE, which includes secondary transition. So many of you on the call, I'm sure, know that in Maryland, students begin at age 14, requiring a transition plan as part of their IEP. In some states, and the federal government recognizes 16. We start a little earlier. So the secondary transition process really is about preparing those students for life after school, making sure that the services and supports that they are receiving during school continue in some capacity when they leave. The end result is always those positive post-school outcomes. So I'm going to talk a little bit today, but during this time, we see that transition services and activities may need to be heightened through flexible, meaningful opportunities that may include virtual or online learning, remote instruction, computer-based instruction. There's been such an urgency to continue to implement a student's IEP, and we've had challenging moments, but the intent and the expectation remains the same. So with regard to the autism waiver, which we'll also discuss today, we are here to report that 126 individuals and their families are scheduled to exit the autism waiver on June 30th, 2020, in a few weeks. And almost every one of them will age into the DDA system of supports and services. So each of these individuals, like all those others transitioning into DDA services, require an individualized plan, support, and services. So we are happy, and I speak for Marcella, we are very, very happy to have this opportunity to share this collaborative relationship with the Maryland Department of Health, who serves as the state Medicaid agency, and with DDA to ensure successful transitions for each and every youth transitioning. So the next slide, we're going to talk a little bit about some of the challenges we faced for our transitioning youth, our TY, and more importantly, how they've been addressed. So as many of you know, obviously we've been in this pandemic. It's been, I think it's the 14th week. I think that's what someone told me the other day. So when school buildings closed in March, as did much of the community, some of our challenges focused on the need for continuity of learning. It came right from Dr. Salmon and the delivery of that instruction, knowing that the IEP and providing FAPE was alive and well, as I mentioned earlier. But looking specifically at the overarching purpose and goal for the student and identifying those activities that happen on an annual basis could be delivered virtually was definitely part of the process. So as we identify those activities to be implemented, we utilized our national partners who compiled and shared various virtual resources and strategies aimed at continuing instruction and addressing the transition-related content and providing examples that included at-home activities, because clearly the role of the family became even more heightened. Much of the creativity came from our relationships with our families, our students, and community partners, including our providers and our state agencies, and how we identify and address those transition activities that will correlate with maybe the experiences with what providers are able to provide and support. There were some benefits to creative implementation, which I'll address in a future slide. I wanted to mention summer. Summer is definitely posing, we're into summer, I guess, but schools are closing. The school year is wrapping up, and summer is posing some additional challenges due to many of the traditional offerings, some of the employment programs, some of the self-advocacy programs, the career exploration camps, social events. They're not happening in the traditional way. Since we are entering phase 2, and I know that Deputy Secretary Simons, I'm sorry, I'm fumbling over words. Deputy Secretary Simons mentioned that we are in phase 2, but several of our businesses, parks, and other places are opening. There may be some modified components of summer activities that align with the IEP that can be delivered through our schools or with support from our community providers. So that is something that is ever changing as we are working across the state with our regional offices. So keeping in mind that our state leaders, the next bullet, the state leaders we're developing a career, developing a career recovery plan. And in our division, we are to follow suit. And the expectation is that local jurisdictions will also create individual local recovery plans. The plans are meant to anticipate how the implementation of the IEP is going to be affected when schools resumed, some level returning to normal. So in response to that, secondary transition teams at the state level, the secondary transition team at the state level created a continuum of service delivery that focused specifically on 3 phases, which was school closure, modified opening, modified or partial opening, and then the third phase being full opening. But across the recovery plan were considerations in how to implement the plan within the 3 phases, but more importantly, the considerations for the roles of the families and their engagement, the role of the students, the role of the schools, and the role of the community partners across those 3 phases. There was really an emphasis on how schools are collaborating with community partners, really to better blend those services and involve providers in the delivery of those transition activities. Finally, agency linkages in the IEP. This has long been recognized as a crucial and required component to a student's transition planning process. It used to be that it was at the end of their school career they focused on that. We know now that beginning early is really, really crucial. So as a result of COVID, this was still recognized as a real top priority, especially during phase 1, with school buildings closed. Local school systems identified support staff to assist with connecting with families and students that are exiting at the end of the school year. As part of their annual IEP meeting, linkages for agencies is always discussed, but even more crucial for students to be linked with someone that can provide some level of support after they exit school. In addition, as part of the linkage to DDA, there needs to be the selection of a community provider to support and provide services to students and their families. Our guidance has always been to start early with application to DDA, as well as engaging in school events where students and families can meet community providers, find the right fit based on the student's goals and plans for the future. So clearly, with in terms of the pandemic, many of these events that were traditionally in person and oftentimes happened in the spring, they're now looking at virtual elements when providers can share their organization's missions, their services, and the supports they provide. So our response and guidance have been to ensure that the referral, the application, and the support from our partner state agencies is of utmost importance. This transition phase of the handoff from school to the adult service system is just so crucial, even more so now. Staying in contact with the transition coordinators and the IEP team to make sure there are no concerns or questions from students and their families is one way. We also encourage our local school systems to keep, if they don't have one, to develop a working relationship or keep their working relationship with their partner regional offices. The best case scenario that we always say is that there's transparency with who is exiting, who is eligible, and then support them in selecting a provider. So the next slide will focus on a little bit of the challenges specific to the autism waiver for transitioning youth. So these challenges specific to the autism waiver for transitioning youth during COVID include ensuring that the continuity of service provision during the fluctuating state of emergency, provider agency closures, staff shortages, limited capacity to support participants and their families. Another challenge was ensuring that a seamless transition between autism waiver and DDA services was in place. The fast-paced, constantly evolving, goodness, that's true, fast-paced, constantly evolving response to COVID-19. It seems to me like every day is a new day and new things are happening. And then the time-sensitive nature of transition and service delivery. We know that there is a time limit to this. And then ensuring that all parties remain informed and involved. The relationship is so key here. So in response to some of the challenges, the MSDE and the Maryland Department of Health collaboration to draft and submit the Appendix K and the receipt of approval granting autism waiver flexibilities with regulations and increasing service hours and allowing autism waiver participants and their families to remain on the waiver if their DDA linkage is impacted by COVID. We also have the coordinated and continued effort to collaborate between MSDE, DDA, and Medicaid. Also, the implementation of critical transitioning youth surveys with autism waiver service coordinators to understand each individual circumstance for autism waiver transitioning youth. Partnerships crucial between autism waiver service coordinators and coordinators of community services, the CCSs. They've been enhanced with Lloyd Pusey and Janet Furman in the lead, coupled with DDA support and outreach to those CCS workers in regional offices. A tracking spreadsheet was developed on the status of the 126, as I mentioned earlier, autism waiver participants aging out or graduating this year, and became a shared document between MSDE, Maryland Department of Health, and DDA, so that all partners are on the same page and can track progress on a real-time basis. And then finally, we have developed ongoing training and technical assistance for service coordinators and CCSs to ensure parent choice for a continuum of service delivery. Next slide, please. So there have been some really interesting lessons learned or positive outcomes that we have heard about as a result of COVID-19. As much as it's been a moving target these last 14 weeks, there really has been some things that have come to light that I feel like I can't, this is a perfect place to share this. But across all transitions, we are really seeing enhanced engagement with our transition students and our families as services are provided in a more virtual or distance learning environment, which in many, many cases, I'm sure it's the same here, in many cases, it's uncharted territory for a lot of people. For example, students seem to be more responsive and engaged participating in assessments and completing those transition activities. This may be attributed to being in the comfort of their home or having an opportunity to think about the activity or assessment without outside distractions. For families in particular, And we are seeing family members partner with transition professionals and community partners in very different ways. Informing families of those activities and the assessments ahead of time allows them to further support their students, and more importantly, giving them time to see the connection between the assessments, what we're asking them to do, and those activities that are created based on those assessments. It seems that in these times, we're seeing a lot more questions being asked by families and asking for clarification to better understand the transition process. This virtual learning process promoted relationships which leads to better partnership and trust, which we know is a critical part with our families, especially as we're wrapping up school and moving into the adult service world. In addition, the virtual IEP meetings that we're having to do, again, uncharted territory. Delivery of instruction has gotten a positive response from families and community partner agencies and providers. So participation and attendance has increased, and for some, the ease of connecting virtually versus face-to-face has been a really efficient way for agencies, especially invited agencies and other partners, to attend and contribute. You know, it also seems that the student is more comfortable sharing in their home setting about what's working for them, what's not working for them, some of their interests. So local school systems have wondered if offering a virtual option would be beneficial when they do reopen schools fully. And it's definitely something that's coming up more and more frequently across the state.
Christie, you have 2 minutes left.
Okay, got it. Okay, so also support staff. We're using job coaches, paraeducators, and job developers in much more creative ways. And also relationships being a priority, establishing goals with your agency and community partners, leading to approaches to delivering work-based learning and career exploration activities. LSS is encouraging them to continue to reach out to their regional agency offices and partner. And finally, collaboration, intentional and deliberate across partners is critical. Open communication between schools, agencies, providers, and students allows for that uninterrupted transition. And the last slide is just some links that we put in there that we can certainly share. And these are links that have all the resources that we've developed in these 14 weeks pertaining to COVID around a variety of areas. We also have the Appendix K, the link to the Appendix K document as well. Thank you so much. Is that 2 minutes? That was fast.
Thank you, Christie. Really appreciate you. Thanks. There's lots of questions come up, and I think we're going to have Marlena Hutchinson help us answer some of those, especially about the choice of people being able to stay in the autism waiver with the whole pandemic crisis. So okay. I'm now going to introduce Lori.
Hi, thank you. So good afternoon, everyone. Thank you to Deputy Secretary Simons for inviting me to be here and for the nice introduction from Secretary Beatty. So I am Lori Markland. I am the Executive Director of the Maryland Assistive Technology Program. Quickly, every state has an assistive technology program. So we are the one that serves the state of Maryland. Go to the next slide. I'll go through this quickly. I'd like to kind of put a face to who I am. I have worked with MDTOP for 20 years. As Secretary Beatty had noted, I've got a master's and bachelor's degree from University of Baltimore. I live in the city. I have 3 kids and a bonus kid, and I have been part of this AT world for a long time. I was in the AT world before having children, and one of the experiences is having the opportunity to now integrate AT into our everyday life. So I do have a daughter with nonverbal learning disability, ADHD, severe anxiety. I have been part of the IEP process. So as Christie noted, sort of the virtual IEPs that have been happening. I just recently had one last week. So one of those IEP meetings has been done virtually. It was a solidly good experience. But a part of what I do now, not only talking about AT and integrating it across state practices, but also incorporating it into my own life. So we do all kinds of things where we incorporate skills building apps and timers and limits and all kinds of things. So as a parent, I certainly understand and value the importance of assistive technology and how it can help benefit folks. Next slide, please. Thank you. So we are the AT program that serves the state. We provide assistive technology services that include demonstrations of technology, device loans. We provide resources to access used assistive technology. We run a low-interest financial loan program to purchase assistive technology, and we offer assistive technology training. So I'm going to kind of go into details of each of these areas. And when we talk about assistive technology, it's really any type of device or equipment that can help improve independence, whether that's independence in education, employment, community living, regardless of what it is. It's equipment that's going to build that independence. And that equipment can come in the form of apps. It can come in the form of something that you go and buy at, you know, Bed Bath & Beyond, or something you get off of Amazon or a specialty store. Assistive technology really runs the gamut. So it can be pretty much anything that's going to bolster independence. Next slide, please. And really what technology does is it makes things possible. So for all of us now, we could not be working during the age of COVID if we did not have technology in front of us. We could not be learning if we did not have AT in front of us. And so the AT services flowchart here is really just a guide for what every state program does. I just kind of touched on that, information and assistance. So people reach out to us daily by phone, by email, with questions about technology, and we guide them to finding the right solutions. We're providing these demonstrations, we're providing these loans, we're providing access to gently used technology and to financing. Next slide. So specifically, what do? We run 3 assistive technology libraries across the state. We have one in Central Baltimore. So that's in Baltimore City. We have one in Southern Maryland, housed in the Southern Maryland Center for Independent Living, and one on the Eastern Shore, housed in the Bay Area Center for Independent Living. And so these libraries are physical spaces where you can go. Typically, you need to make an appointment, but you can go there. You can try out, look at different devices, meet with an expert to sort of explore what's useful to you, and then borrow that item for up to 4 weeks at a time. And when I talk about technology in these libraries, again, it runs the gamut. So we have some very low-tech items, things that can help someone maybe write more independently or cook more independently, all the way up to highly customized eye gaze technology to access computers or adaptive gaming systems. So it really runs a wide variety. And that's because we want to make sure we're covering all age ranges, all types of disabilities. And so we make sure that our libraries are very diverse. We conduct assistive technology demonstrations with our AT clinicians. Previously, these were done in person. Right now, we are offering these virtually, and we'll continue to offer virtual consults. Even as we can meet one-on-one with folks, we will continue to offer the virtual option because it is beneficial for some individuals. But we do like to work and sit down with folks one-on-one so we can really sort of gauge what is helpful, what isn't helpful. There are sometimes nuances to technology that is really helpful when you have a chance to hands-on explore it. We can issue these short-term device loans. So like the public library for books, we're the public library for assistive technology. We host webinars and trainings. We do lots of presentations on assistive technology, and we often will customize our presentations. So if people are interested in smart home devices, we will hold a presentation just on how to incorporate smart home technology for more independent skills in the kitchen, things like that. We run an online equipment reuse exchange platform. Essentially, this is through Facebook. It's a Facebook yard sale page, but folks can hop on there. They can post items that they're looking for, that they're selling, and that they're giving away, and we can help make those connections. So we're really facilitating these exchanges. We also recently launched a high-tech AT reuse center in Howard County. It's in the loan closet of Howard County. And this is a place where folks have donated to us some higher tech devices, video magnifiers, communication devices, eye gaze systems, equipment that folks no longer need. We refurbish it, we repair it if it needs any repair, we sanitize it, and then we make it available for free to anyone who needs it for as long as they need it. We also run the low interest financial loan program. And then we are a partner with the telecommunications program in the state. So we have 3 assistive technology or adaptive telephone libraries as well across the state. So these are little libraries where you can go in and see different types of adapted telephones. You can meet with a telephone evaluator, have an evaluation done, and if you qualify, have one of these phones purchased for you. Next slide. If you go to our website, there are a few additional resources. You can see a virtual library of ours. So that has a lot of AT equipment that's in our libraries. We have it listed here, so you can kind of explore it online. It doesn't have everything, but it does have a pretty good, it's a pretty good representation of what you can find in any of our libraries. We also have a home modifications directory. So for folks that need to get information on how to make their homes more accessible, this includes providers, contractors, funding resources, all the information that you're going to need to make those modifications to your home. And then we also run a loan closet directory, or have a loan closet directory on our website. And that is a document that lists different equipment loan closets across the state. Loan closets are places where you can go and get things like gently used walkers, toileting aids, bathing aids, wheelchairs, whatever type of durable medical equipment is available that they've taken in, they make them available. So we do have this directory of loan closets across the state. So what you'll find at our library, I'm not going to go through all of these, but this kind of gives a good visual representation. We have communication devices, we have feeding aids. So on the right hand picture on the top row here, those are adapted spoons. We have electronic magnifiers. We have assistive listening devices, so devices that amplify sound for folks. We have eye gaze technology. We have adapted keyboards. Go to the next screen. We have accessible gaming equipment. We have smart home technology in our library. So if folks come out and visit us in our Baltimore library, you're going to see a live demonstration of how you can set up parts of your home to be, smart. So we have the Alexa Dot, Alexa Echo. We have it set up with a smart stove. We have it set up with our lights, so we can actually demonstrate how to set up a home for greater independence. Next slide. And then we have our iDevices, lots of iPads, iPhones, iPods, and Android-based tablets, so folks can certainly try out different apps that are available. And then on this PowerPoint, we do have a link to our Facebook Exchange site. So these are some items that have been posted in the past: lift chairs, stair lifts, toileting aids. So this is a great place to find equipment that you might need, and you can post here if you're looking for something. But it's a great way to just sort of connect with the community and find out what's available. Next slide. And then our AT Reuse Center, our high-tech AT Reuse Center, we include things like video magnifiers, adapted computer keyboards, iDevices, speech communication devices, amplified phones. It is by appointment only, so if someone wants to make an appointment, they just need to reach out to us. Next slide. Our financial loan program, we issue loans between $500 and $50,000, and that covers all types of AT. That also includes vehicles, adapted vehicles, home modifications. So as folks are trying to figure out what they need, they're finding funding resources, but maybe it doesn't cover the full cost of everything that they're in need of, they can certainly reach out to us and apply through our financial loan program. And then we also partner with AT Discount Sales and Services. That is a company that actually negotiates discounted prices on assistive technology across the state. So folks can easily reach out to us and reach out to AT Discount Sales, and we can make sure that they're getting the best price available on the technology that they're purchasing. Next slide. In our partnership with Maryland Accessible Telecommunications, we again have these libraries with all types of adapted telephones, and we will work with you and have the device or telephone evaluator work to make sure that the right type of telephone is identified, and if you qualify, the phone is purchased for you. Next slide. You can find us online, all different places, our blog, Facebook, Twitter, YouTube, you name it, we're out there. And then our central office information is here. You can always reach out to us at mdtap@mdtap.org, and on our website there are links. So you can just click a link and send us a message, and it comes directly to me and to our AT clinicians, and we respond within 24 hours. So I hope I wrapped that up quickly enough so that we have time for questions.
Thank you so much, Lori. I appreciate it. And everybody has the PowerPoint they can download on the handout section of today. So thank you so much. I'm going to turn it over for questions. So I'm going to have Rhonda Workman. Can you please start reading some questions, please?
Sure, absolutely. So let me grab a couple here. For Lori, is the training that is offered by Maryland Technology Assistance Program offered for family members that may support individuals that may have lower functionings who may be challenged with using technology such as tablets, or is the training for the person being supported only?
It's for family members, providers, individuals directly. We serve everybody. Great.
And I think we were going to try to open up the line for Marlena. Donna, if you could do that. So that
she's on. She's on.
Oh, okay.
She's on.
Great. Marlena, did you want to share a couple thoughts?
Sure. Can you hear me?
Yes, we can. Thank you.
Okay, great. Good afternoon. This is Marlena Hutchinson. I am the acting director for the Office of Long-Term Services and Supports within the Medicaid program. Thank you so much for the opportunity to join you all this afternoon and to participate in this webinar. As previously stated, as the state Medicaid agency, we actually have the administrative authority over 8, 19, 15C waiver programs. 3 of those waiver programs are operated by the Developmental Disabilities Administration, and the Autism waiver is operated by the Maryland State Department of Education. What I wanted to do was speak a little bit about the maintenance of effort that the Medicaid agency has been able to get approved by the Centers for Medicare and Medicaid Services. This maintenance of effort provision allows individuals to remain in their current waiver programs without disruption, without termination, without disenrollment until the end of the state of emergency. Fortunately, by way of the what we call the Appendix K waiver application, which actually amends the current waiver application and allows us to make temporary provisions or revisions to the existing waiver program. By way of the Appendix K, we are able to keep certain things in place during the state of emergency. With the maintenance of effort for autism waiver participants, they are allowed to stay in the waiver program until a successful and safe transition is achieved. The Medicaid office, as well as the Department of Disabilities and the Maryland State Department of Education, we are working very closely, as we are partners, we're working very closely together to ensure that a participant is, or their family is very well informed about what the options are in regard to the maintenance of effort, and allow families to make an informed decision as to whether they want to remain in the autism waiver or go ahead and transition into the DDA waiver until, while all services and supports are in place. My apologies. This Appendix K waiver application, as I said, it's effective March 1st of 2020, just on the early onset of the pandemic. And it actually is approved through February 28th, 2021. So it gives the three agencies an opportunity to really dive in to the individual program, participant situations to help families make those informed decisions. With that, in addition to keeping waiver participants in their existing waiver program, by way of the autism waiver, the Medicaid agency also requested an increase of hours for respite care, family consultation, adult life planning, and intensive individual support services. So for respite care, we've actually requested and have been approved for an additional 672 hours. For family consultation, an additional 20 hours. For adult life planning, an additional 30 hours. And for intensive individual support services, and an additional 15 hours per week. With IISS, we've also gotten the provision or the authority to allow legally responsible individuals to become employed by the IISS agency and be paid for the services that they provide their loved ones during the state of emergency. So we've done a lot of partnering together, working with families, working with our stakeholder groups as this pandemic has really taken the entire globe by storm, working very closely together to see how we can, again, keep families, keep participants safe and healthy in their communities. So that's all I have right now in regard to.
I have a question directly to you. If the governor takes us out of the state of emergency, will Appendix K continue?
So with the provision, we would have to basically work with the governor's office in regard to what we have federally approved. Right now, it is approved through February of 2021, and some provisions will have to go away upon the end of the state of emergency. But by way of the Appendix K, we are approved through 2021.
Thank you.
Great. Thank you. Thank you, Marlena. This is a question for the Department of Disabilities. So Secretary Beatty or Lori, if you want to answer. The question is, does the Department of Disabilities break out data to identify utilization and access of services across races and other demographics? What percentage of assistive technology usage is represented by people of color?
I think that would be a Lori question.
Yeah, I can jump in. So we do not track data by race. We have federal parameters that are identified for what we track. We do track data based on type of assistive technology needed, which often gives us an indication of the type of disability. We do have some age range data that we can identify, but we do not track by race.
Great, thank you. And this is a question for Christie. How can parents participate in the individual plan meeting across coming up? Is there a form that will address the changes in services? I cannot rubber stamp goals from last year, given that we're not sure whether people will be going back to work or school.
That's a great question. And you're saying the individual recovery plans that the schools are doing, or the plans for the students? I think you meant the students, correct?
The students, yes.
Yes. I definitely think, you know, there's always been a role for parents as part of the IEP process. I think in lieu of COVID-19 and the kind of natural engagement that schools are doing with families because they have to with the virtual environment, I think connecting with your school system and saying that you want to be at the table 100%, I think that will be a perfectly appropriate thing to do, so that you are engaged and have a say in the development of those goals and what's going to be addressed.
Great, thank you, Christie.
And here's
So Rhonda, I have a question is, how will parents on the autism waiver be notified of the extension of the autism waiver services to TY beyond June 30th? Will the 126 TYs be contacted by MSDE, MDH, DDA before June 30th? So this either Marlena, you can answer, or Christie, whoever feels comfortable answering this question.
So hi, this is Marlena. The Medicaid office and DDA offices both are within the Maryland Department of Health. So in collaboration with our partners at MSDE, the family members will be informed by way of their service coordinators under the Autism Waiver Program and their CCS by way of the DDA waiver.
Great, and we have another question for Lori. This question is, do you have speech-to-text assistive technology that a student can use to be successful in school and or college? How do we get a loan to try the different choices of speech-to-text out? If we decide to work for the student, how can we get the loan or financing for the product?
That's a really good question. So yes, we do have speech-to-text software. We don't typically loan the software, but what we could do is set up a time for a consultation to try it out, see what works. And then once that's identified, if it's not available in the school system, but you want to have it available at home, then we can guide you through the process of applying for a financial loan through our assistive technology program. But you could email me, and it might be helpful if I give everybody my direct email address, which is Lori, Lori, .Markland, MARKLAND, @maryland.gov. And then you can email me sort of your individual requests, and I'll put you directly in touch with our AT clinicians, and they will set up those meetings and times with you to kind of go over the options.
Great, thank you. And there was another question, Marlena, I think you touched on this, but you can add to it. It's, can participants fall out of a DDA waiver during the pandemic?
No, by way of the maintenance of effort provision that's in place through February 28th, 2021, participants will not be disenrolled from waiver programs.
And Marlena, that's all waiver programs, is that correct?
Correct.
Right. Just looking through some more. There was a question for you, Marlena. It was about the additional service hours for the autism waiver that you mentioned, whether the information was documented anywhere. I would add that in the PowerPoint, that Christie's slide had a link to the Autism Waiver Appendix K, which noted those increase in hours. But Marlena, you can go ahead and share some additional information about the website that you guys have.
Correct. In addition to those slides, on the MSDE website, as well as the MDH website, we have the actual approved Appendix K waiver application posted for public viewing.
Great, thank you. And I think we're at the 2 o'clock.
So there's one more question.
Okay,
thank you, Rhonda. Appreciate it. There's one last question, and this is for Deputy Secretary Bernard Simons, and it is, can you update us on the FY21 rates?
I actually had a conversation yesterday about our rates with MAC's Executive Director, Laura Howell. And I actually sent her an email, and I'll pull it up so I have the exact wording that I sent to her about our rates, etc. And so hold on a second while I look for my email. Patricia, go ahead and take another question while I'm looking for the email.
Sure, will do. The next one is Lori. Does the Department of Disability break? I'm sorry. Hold on. It was about the communication. Does the Department of Disability does the assessments via virtual support?
That's a really good question. So we have to be very careful about what we call the work that we do, but we call it assistive technology consultations. And a consult is really consumer choice driven. And what that means is we sit down with the consumer, family members, show a variety of devices, and the consumer gets to decide what works best for him or her. And we are doing these virtually right now. We will continue to offer them virtually. In some instances, virtual works just fine. In some instances, it's not as practical because there may need to be a hands-on component to that virtual consultation. But we are currently doing virtual only, and it's been relatively successful thus far. So yes, we can do that, and you can always reach out directly to us to request a consult, and we will certainly schedule that.
Thank you, Lori.
So I found my email, and this is what I said to Laura Howell yesterday when she reached out to me about what was the budget for DDA looking at. As you know, our budget goes through the department since we're one of the 4 administrations, and then from there goes on to the Department of Budget and Management. And this was the question that she asked about the rate. And what I sent to her was a final decision on rates will be made early in the fiscal year, and rates/payments will be adjusted accordingly. And that's what I had from DVM.
Thank you, Bernie, for that critical information. So this concludes our webinar for today. Thank you so much and appreciate you joining us. Please be safe, stay well, and thank you for our panelists. Have a great weekend.